Hi guys, this is Michelle from Virtual Hand Care, and in this video I'm going to share with you my top 3 trigger finger exercises. This video is only going to go over exercises if you're looking for a lot more information on trigger finger as far as wearing splints and treatments and other things to try. I have several other trigger thumb and trigger finger videos that you're going to want to check out here. So before we start these exercises, do make sure that you have seen a doctor to make sure that you know that you do definitely have trigger finger, but also that you know the severity of trigger finger, and also make sure you do get clearance before you start these kind of exercise or any kind of exercise program. Now keep in mind, none of these exercises are to cause any kind of pain or any kind of triggering. First, if you're wearing any kind of splint, such as an oval 8, to prevent the triggering, you're going to want to go ahead and remove that for these exercises. Okay, exercise number 1. This one is a passive stretch. So oftentimes, if you're wearing some kind of a brace, the finger is going to get very, very stiff, and it's probably a little swollen too. So you might notice some joint stiffness and achiness. What we want to do is loosen up the joints in the fingers, but this particular stretch is also going to work on stretching the intrinsic muscles. So sometimes those intrinsic muscles can get very, very tight as well. So what you want to do for this one is you're going to use your other hand to help stretch the DIP and the PIP joint of that finger that is triggering. So say it is my middle finger that is the triggering finger. You want to make sure that your hand is completely relaxed and your other hand is going to do all the work. If you feel any kind of triggering or you think your finger is going to trigger with this one, then just take some good breaths and make sure that that hand is relaxed, because more times than not, you're not truly relaxed and you're kind of helping that stretch, and therefore you're kind of contracting that tendon. With passive stretches, you shouldn't get any kind of triggering because that's not contracting that swollen area of the tendon through the pulley. So you shouldn't get any kind of triggering with that. So to do this stretch, what you want to do is take your other hand and you want to take the tip of the finger that's triggering, and you're going to stretch the DIP and then come down and stretch the next joint down, which is the PIP. And then again, make sure that the fingers are nice and relaxed. You can prop your arm up on a table if you want to. Now with this one, you want to make sure that the knuckle is as straight as possible. So my fingers are relaxed, DIP joint, PIP joint is bent. And then I'm actually pushing back a little bit into even a little bit of hyperextension. And you can even take your hand this way and stretch it back this way. Now you may feel a little stretching and pulling even down into here, and that's okay. Shouldn't be painful though, but you're just looking to stretch the DIP and the PIP, and we're looking to stretch all in those intrinsic muscles that are in the hand surrounding that area that is all swollen. And then you want to pull that back up and stretch up into extension and hold a couple seconds. So each of those stretches is going to be a couple of seconds. So I'm going to show you again, but I'm going to show you with my arm down, and slowly push down that DIP and that PIP, stretching back so that the knuckle is in a little bit of hyperextension. Hold a couple of seconds, fingers are nice and relaxed. And then back up and stretch a little bit straight. Let's do a couple more of those, stretching down, pushing back. And back up. And you would want to do about 10 of those a couple of times a day. Exercise number 2 is a isometric contraction to the FDP tendon. So the FDP tendon, or your Flexor Digitorum Profundus, that long tendon is the one that that gets stuck when you have trigger finger. There's actually recent research that shows that isometric contraction exercises can help stretch the pulley out and therefore make more room when you go to flex your finger and therefore not trigger. You're going to want to grab yourself like a towel, something that you can roll up to place under the finger that is triggering, because you have to place your finger at about 45 degrees of MP flexion. That can lead to better stretch on that pulley. So say again that my middle finger is the finger that is triggering. You're going to kind of weave this washcloth in between the fingers, or whichever finger is the triggering finger. You can do this for any of the fingers, but you want to make sure that the finger that you are working on is placed in about 45 degrees of MP flexion. So that's the knuckle right here. So you want to rest your hand on the table, and then as you can see, this washcloth is placed under my middle finger, and my knuckle has a nice bend in it right here. So it's close to about a 45-degree angle. No other joints are bending with this one. So what we want to do, we want to apply a downward pressure to the tip of the finger only. And then your finger is going to resist that pressure. And this is about a mild to moderate amount of pressure. And you want to hold a couple of seconds and relax. And as you can see here, by me applying some resistance to my FDP tendon, you can see some contraction happening in that tendon all along the sheath. And therefore, my pulleys are getting a nice little stretch as well, because the tendon is contracting. And because it's bent, it's actually contracting, it's actually bowing a little bit to allow for a stretch on that pulley. And so you would want to do that about 10 times. Well, let's do a couple of those together. Ready? Hold, 1, 2, 3, and relax. 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 And again, if your ring finger is the one that's triggering, you can put the washcloth kind of this way. If your index finger is also triggering, you could do it this way as well. So you could apply pressure to the ring this way and pressure to the index finger this way. Again, as long as only the metacarpal is what's bent at about 45 degrees. And you could do it this way for the small finger. Now with the small finger, I would probably support it in just a little bit more flexion, because when you do this, as you can see, my knuckle is not quite in enough flexion. So do make sure that you've kind of accommodated for that, and you put your small finger metacarpal in a little more flexion before you go to apply some resistance to that finger. Hold each of those exercises for a couple of seconds, but repeat about 10 of them. And I would do them a couple of times a day as well. So exercise number 3, this is a DIP blocking exercise. So the first exercise was more of a passive stretch. The second one was more of a strengthening. And then this third exercise is more of an active gliding of that FDP, just to get things moving a little bit through this inflamed space, but we're doing it in a protected way. So prop up on your elbow, and you're going to use your other hand to block the PIP joint, and then you want to come right below the DIP joint here. And what you're going to do is you're going to apply a little bit of pressure and actively bend just the tip of your finger. This is called a DIP blocking exercise. And you want to do about 10 of those. Now, if you have an oval 8, you could put the oval 8 on and slip that on your finger. And then you could make sure that you're just bending the tip of the finger that way. But as you can see, you're going to get a little bit of bend in this joint with this. So that's why I still like to block and just get that DIP tendon to move. And I wouldn't just wiggle this. I would bend down, hold just a few seconds, and back up and hold just a few seconds and back up. And if it's your ring finger, it would look this way. And if it's to your small finger, you would do it this way. And if it's to your index finger, it would look like this. And you should do about 10 repetitions of those a couple of times a day. Let me know in the comments below if you've tried these exercises or any of the other trigger finger videos. If you did find this video helpful, do please give it a like, and also don't forget to hit that subscribe button below and check out these videos here that YouTube is suggesting for you. Thanks for watching.